Good afternoon and welcome. Well, the COVID crisis has certainly had a huge impact on all of our lives, and this one, this annual event or twice annual event, Aging at Altitude, has been done in person at the Jewish Community Center. The last couple of events this year, for the first time, we decided to do it as a virtual expo and webinar series, and the participation and interest has been absolutely astoundingly high. My name is Al Manzi. I'm the president and CEO for Prairie Mountain Media and also publisher for The Camera and the moderator for today's event. Today's session will be very interesting. It's entitled Telehealth, and we've got two individuals who'll be taking information about how telehealth is impacting their portions of the business. And we all know that that's going to continue to grow in our lives, so it'll be very interesting for us. It's our 12th session overall. We've got one more tomorrow. Before we start, I want to remind everybody at the bottom of your screen that you'll see a Q&A and chat feature, and you can type in your questions at any time during the presentation. We'll take the questions at the end after 40 minutes of presentation. Be about 20 minutes for what we hope to be a very vibrant question and answer period. So feel free to type in your questions anytime during the presentation. Now let's get started. Today we'll be hearing two presentations, one by Samantha Warren with Boulder Valley Hearing Associates and one from Mary Hammack from True Community Care. Please welcome Samantha Warren as our first presenter.
Hi, Al, thank you. I'm gonna go ahead and share my screen in just a moment. So glad to be with everyone here today. So I work with the fabulous physicians with Boulder Valley Ear, Nose, and Throat. We are two businesses basically within the one. So I work with the fabulous physicians, anybody who's had an ear, nose, and throat problem. You've known somebody who's had a tonsillectomy or a broken nose. Chances are you've probably worked with these guys. I think their average experience levels is 34 years between the four of them. And then we're going to be focusing on some of the hearing aspects, which is my role. I'm a doctor of audiology, and I'm currently the clinical director of the audiology department. And also we're going to sprinkle in some of the telemedicine pieces that have been working and been fantastic actually for the ear, nose, and throat side of things as well. While COVID was not anticipated and has not been very welcome, I do think that this has forced a lot of companies, ours included, to embrace some of the technologies that have frankly been available for a long time. And so it's just been, we've been able to streamline it, which has been fantastic for patients who are more than just maybe immunocompromised or maybe sick. It's been great for actually a lot of people. So today we're going to talk through what telemedicine is. So the literal definition, what formats it can take or how the different appointments can go. We're going to talk, sorry about that. We're also going to talk through how effective is it? So I know that that's a big question that a lot of patients have. So what do I give up by not having an in-person appointments? How much can you actually get done remotely? Is it safe? So in the manners of how safe electronically, cybersecurity type of an idea. How complex is the setup? I know that's another main concern of a lot of patients when we offer that to them is, okay, well, what do I need to have to get this done? And then who are the best candidates or who should be utilizing this opportunity or this technology? Telemedicine for me in terms of an interest goes all the way back to 2010. It's what my thesis, if you will, for graduate school was on. I was targeting patients who were in nursing home or maybe had limited transportation availability. So that was actually what I spent most of my dissertation on. So telemedicine, if we're getting down to kind of the most general definition is just remotely addressing a patient's concern. So we have been doing telemedicine forever. It's a phone call to say, how should I be utilizing this medication again? What did you say? How many times a day? It can be as simple as a phone call that's remotely helping somebody. It can be as simple as an email with an exchange back and forth to, on our end, it's helping to troubleshoot. Maybe a device became disconnected, maybe they're having battery troubles, but it can be as simple as email exchanges. And then I think the form that a lot of people picture is video chatting. So what we're doing today. So the video chatting platforms there are many available, including Zoom. In healthcare, we tend to use different types of portals that have more encryptions and more security available. And then we also have been able, as of recently, to remotely program devices, which has been a learning curve, but it's actually been phenomenal for patients. We've been able to access them when they're in different places. We've been able to access them remotely so that they don't have to come into the office. So it's been really helpful actually in helping to maintain that social distance. In terms of the effectiveness, I think this is everybody's big question on what do you give up with a telemedicine visit? So the biggest thing that I think a lot of people are concerned is that they don't get that hands-on exam and the limited visibility with a provider. So with the hands-on exam part of the appointments, there will be a patient who calls in that we've had probably a couple hundred telemedicine visits over the last 6 weeks. And there'll be a patient that calls in with a lump or a bump or something, and we're able to remotely connect to them. And while the physician, with all of their years of experience, is not able to physically examine that lump or bump, what we've actually found is tons of patients, they've been able to describe the lump or bump or with the onset or things like that, and we've actually been able to accurately diagnose their problem. In some instances, it's been a video chat or a phone call, and then we've ordered testing or imaging, and then when they have a follow-up, either telemedicine appointment or they come into the office physically, they've actually saved a trip because we needed more information in order to make an accurate diagnosis. So they saved themselves a visit into the office because we needed more information to be able to have more of a conversation. So that, I think, has been something that we in our office have actually started triaging of, okay, this is available to you. We would suggest that you take this opportunity to do a televisit because they may be recommending imaging. They may be recommending, a biopsy at this office. So it's actually been really nice for patients because we've almost kind of been able to phone order more information, which has been fantastic. Another, I know, concern for a lot of patients is just the limited visibility. So literally limited visibility of being able to see those ear, nose, and throat concerns. So we won't be able to look in your ears to check and see if there's wax, but even with the poor connection with a webcam, we've actually been able to diagnose and visualize within ear, nose, and throat concerns. We've even had instances where there was a patient who was having dizzy spells, and we were actually able to diagnose the dizzy spells and prescribe the maneuvers via web chatting. And it's well known in the medical industry, but I don't know how well known it is for consumers. But case history alone really does help to identify, or really is the vast majority of what we use in diagnoses. So it's that back and forth of the questions. So that's been actually really effective in terms of how many visits have been able to be done via telemedicine. There are certain visits that, we start with the telemedicine visit and then it triages down into, okay, well, we can't cauterize that nosebleed over web chat, or it does sound like there might be a blockage in your hearing and I can't see it from here. So there have been instances where patients have had to come in, but for our established patients who are just calling in for a prescription refill, for established patients who call and say, hey, remember that, that sinus episode we had 2 years ago or 6 months ago? It's happening again. Here are the symptoms. So it's actually we've had to start setting aside multiple rooms for our telemedicine visits, because initially we thought, well, maybe just one room, and there won't be enough traffic to require more than one setup for us. It's actually not been the case. We've had to set up multiple rooms because patients have been more than willing to adapt and to embrace this teletechnology that's available to us. And they've been effective in terms of visits. Now, kind of the shared ENT and my side of things, we actually can't do hearing tests technically. There is equipment that's available, but it's more appropriate for like leaving the equipment. I had professors in graduate school that would leave the equipment in certain countries, and then you set up an assistant who would help you set up the hearing test, and I could sit here and do a hearing test in Africa. Or if you were living in certain more mountain areas, you could set up instances there. The equipment is really expensive and it just doesn't make sense. We don't have one kind of home place to set up to do lots of remote hearing tests. So unfortunately, being able to put you inside of, a nice soundproof booth is not really going to be available through telemedicine. And then there are certain initial calibrations that we can't do kind of over the Wi-Fi. So those are the only limitations, but we've been doing this for a few months, and some hearing aids can actually do different parts of a hearing test. If you remember your grade school hearing tests, raise your hand when you hear the beep. We've actually been able to do some of that parts of the test remotely, which has been great for the patients who call and say, I don't know if my hearing has changed. I really don't know that it's an emergency, and I really don't think I need to come into the office for it. We don't know when this is going to end. So it's been nice to use in certain instances where we can say, well, let's just find out really quick. Let's see. Let's try this first, and then we can always do something more. And then in terms of some of the programming and some of the adjustments within hearing aids, we can't do it remotely. So we just make sure that we set those calibrations up before the hearing aids ever leave our office. So there's really not a lot we can't do remotely. This has actually been fantastic because I've had patients who were out of the state when all this started, or who have left the state to go somewhere even more remote. So it's been fantastic because I've been able to actually help them wherever they are. So that's been awesome to work with, and patients have really, really embraced it. It's been really great. So how safe is a visit? So there are several different platforms that exist. I'm not sure how many people had heard there was some weird stuff that was happening through some of the non-encrypted or public Zoom meetings where extra people were jumping on meetings. So we don't use any of those types of platforms. Our current appointments are being done through specific encrypted platforms that are HIPAA compliant, but also meet worldwide safety requirements. So some countries have even more strict requirements than we do. So they actually meet more safety requirements than just as what's required here. What I think is really fantastic through the portals that we're using is that there's no data stored within these portals. So it's not saving anything. You don't download anything to your computer. So that's been really nice for patients who have been, more hesitant or more leery about what they're actually putting into the computer and what's being saved. We actually can't go back and look through things. I actually tried to get screenshots of, I obviously can't do it with a patient for HIPAA reasons, but I tried to get some screenshots of, a medical assistant and somebody doing it, but the images were even showing up so weird and fuzzy that it wasn't usable. So there's no data that's stored. We don't even have access where I can't even go back for insurance recording purposes to look up how long that phone call or how long that video chat lasted for. So that's been comforting on our end of things to know that we may be telemedicine patients in the future too. So that's been comforting on our end of things to see as well. The setup, in terms of complexity of setup, we have not actually run into a lot of IT type of tech support, help this patient's, I can't hear them, their microphone's not working. There isn't any special equipment that's needed. So if your computer has a camera, or if your smartphone or your laptop or their tablets, there's so many things that have cameras anymore. You are able to just log in through there. We obviously can do also lots of our telemedicine visits through phone calls. So for some patients who maybe really didn't have the connections, or I think we encountered one during a rainstorm where their internet was down, we did it through a landline phone call. So we've really been able to adapt and kind of work with this to make this a lot easier. Emails and cameras are definitely preferred because I think that that's what's going to get the most done for everybody, but definitely not required. So I think that a lot of people feel intimidated that they're not going to be able to log in, they're not going to know how to do things. It's been really easy for setup. Like I said, we've done a few hundred of these, and we've rarely had instances, and our patients have been the gamut of, I don't think we've had any pediatric patients. But our oldest patient, I believe, was 98 at last tally, because we were trying to keep track of this just to be comforting for patients. Who should be using telemedicine? This has really been for everybody. So it's for people who are busy. We actually have a colleague within the department who needed to make an appointment for her physician. She called, they offered a tele appointment. She no longer has to worry about the commute down to Lone Tree and back, and how much time should I take off of work, and how long will I be sitting in the office waiting. So it's been fantastic because she's literally accounting for 15 to 20 minutes in her entire day for this appointment that probably would have been a 2 to 3 hour investment before. It's for sick patients. Right now, there's lots of screenings to make sure that we're keeping everybody safe. So, we have patients who have a fever, or who have a cough, or may have been exposed. We obviously don't want them in our office, potentially exposing some of our patients or staff. So this has been a fantastic alternate for patients who maybe are not in the healthiest of states. Also for immunocompromised patients who, again, it's a lot of exposure between parking and coming into the hospital and coming into the waiting room. We've minimized and done as much as we can to keep everybody socially distant, and we have so many infection control procedures, but it feels like a risk. And when this is an acceptable alternate, a lot of patients are really grateful to have this opportunity. And a patient doesn't have to be immunocompromised to be concerned. So just because a patient is healthy and normal, they may have contact with other people in their life who are not as healthy and who are not as lucky. This has also been fantastic. We did an email blast to some of my mountain patients. So this has been fantastic for the long distance patients who have they don't want to come down that canyon road because they're doing blasting again, or it's snowing in May, and so they didn't want to come down. This has been fantastic to be able to remotely help them when they needed it. So, and we've actually seen, in the amount of time it would take you to park your car and walk inside, your appointment could be done. So we've actually seen that a lot of patients have been satisfied, or they've been more satisfied just with their visit or their healthcare in general, because they didn't have to come in. They still got to see our smiling faces, but they didn't necessarily have to come in and engage with every person. So in summary, I think telemedicine appointments, I'm really passionate about this. I think that they're a great alternate to see your healthcare providers in a safe, convenient, and socially distant way, which is all of the rage right now for obvious reasons. Many of the concerns, I would say it's probably 8 out of 10 or 9 out of 10 appointments can actually be addressed from the safety and comfort of your home. So you don't even have to take a shower after the morning gardening. You can just jump right into your appointment. And I cannot stress enough, there is really no special equipment or technology skills that's needed. We just typically need a name or an email, and having a camera that's attached to your smartphone or laptop or computer is definitely going to be the most beneficial. So from all of us, our crews there, yeah, thank you, everybody. And I hope if anybody has any extra questions, I hope you use the tools at the bottom, 3 dots if you're on certain phones, or the little question and answer piece to ask some questions.
Perfect. Mary's up next.
Awesome. Thank you. Let me
Thanks,
get,
Samantha.
yeah, give me
That
1
was
second,
awesome.
Mary. Let me get my screen off here.
I'm Mary Hammack, and I'm a clinical manager and a registered nurse. I am also very proud to say that I too am aging at altitude. Even before the COVID virus hit us all,
Mary, we're not hearing you. Did you hit your mute button perhaps?
probably so. That's my aging part. Even before, we would use FaceTime to talk with family, or Zoom for a business meeting, Google Chat for clients. So we've been using telecommunications for a long time. When COVID hit, it took on a whole new life of its own and has grown exponentially. Through telemedicine, we as patients and families can now have meetings with healthcare providers without even having to leave home, or we don't even have to be in the same state. That's just the broad overview of it. I'm going to show you a few points here. Share my screen. Share. I'm sure there's a quicker way to do it. I just haven't learned it yet. And we go backwards, sorry. With telemedicine now, we can use remote monitoring systems that give nurses the opportunity to do a daily assessment without being there with the patient. We do customized pathways to meet patient needs. There are videos that can be played to assist the patients or families with education, daily monitoring of vitals, and video visits. I'm going to switch over and share my screen with you and give you a little sample of a software program that is used specifically for telehealth. Sure, I am. In this program, you can see we have a lot of test patients set up. Like Samantha said earlier, it's all HIPAA compliant. None of it's stored on the internet or on phones. We have our basic information here that we can use for patients can enter their vital signs and give us information there. They can answer daily questions that our nurses have set up as far as pathways go, care plans. There are videos available for education, little hints and tips on how to take medicine, how to add exercise to your day. We use tablets, computers, smartphones. Like Samantha said, it's really any communication with hook up to the internet or a camera is going to help you. This particular program, I can show you, we've got care plans set up that I talked about earlier. We call them pathways, but other programs that we've seen have called care plans. The one I like here is, this is a patient with Parkinson's disease. So they tend to be a little more susceptible to falls. This has a list of questions that can answer about, have you fallen recently? What's been going on? Do we have to worry about skin tears, fractures, anything like that? So it's been customized for them. They'll go in, they'll look at this, they can answer these questions, excuse me, and that will alert nurses to something different that might be going on. We've got something that shows you all of our patients.
Yeah, Mary,
here.
I'm sorry to interrupt you, but we're not seeing your updated file that you're trying to show, which is, I assume,
Oh,
the
I'm so sorry.
yeah, I assume it's
Great from
it's
me.
the actual program.
It is, and it looks great from my side. So let me see how I can make sure it shares. It says I'm screen sharing. All right, let's try it again. Can you see that?
Now we can see it.
I'm sorry. Thank you very much for letting me know that. This patient that I was looking at earlier, her pathways are for Parkinson's. So we know that she's a fall risk. We can ask her specific questions, as I said, about have you had any recent falls? If you fell, was there any injury? There's questions that they can answer that will give us heads up on what we need to be watching for. Our triage nurses can go in and look at all the patients at a quick glance. In one glance, they can tell if a patient has a higher acuity than others. This is one of our good test patients. She's been entering her own vital signs. So I can tell from this that her blood pressure was rather high. I can tell as a triage nurse, I could look at this and see that she's hearing impaired. I might need Samantha to be talking to her, that she's on dialysis, and that she lives alone. So we want to keep a closer eye on her. We can set up monitoring again. We can have graphs that we can send to their primary care doctor that shares information that they might not be hearing about. As palliative patients, we're in there in more of a middle role. We can support the patient, we can support their providers, and be in between to help answer questions on both sides. There's real-time videos we can share that will give information on, say, heart disease. It'll show a heart and what the heart disease makes the heart do, why it's different than some other disease. With the video portion that is available on a lot of these programs, in addition to our providers meeting with the patient, we can bring in a specialist, we can bring in a family member, we can have a whole care conference, much as we do like with the nursing home. Families and all can jump on from all over and be involved in that patient's care. We can use the video so much in our hospice side that our nurse can walk a family member through something as interesting as wound care. They can say, hold that camera up, let me look at that wound. Oh, you're doing a great job. Here's how to apply that bandage, or how to give some medicine. When we're in the stressful time of having someone in hospice and knowing that they're approaching end of life, it's easy to forget what medicine is given when or how we give any specific medicine. We can be right in their home immediately without having to wait for a nurse to go out to help them. We can talk them through different steps and what needs to be done along the way. There's a lot of reassurance. We can talk to the patient and let them know what's happening right now is normal, or if it's not normal, how we can help them. Gives them a chance to know what's coming up next. Are we going to change medicines? Do we need to get a physician out there? What can we be doing to help in this whole aging and palliative and death and dying process? Our chaplains, our social workers are able to have some very meaningful, in-depth, private conversations that sometimes are easier through video conference than they are in person. I think all of us kind of appreciate the anonymity of not being in the same room when you're sharing some very deeply personal information. So it's been used in ways we never expected. I think what else I was going to say. When patients are having changes in condition, we use this a lot. We can hold up a video or the camera. The family member might say, does this look normal? And again, we can say, yes, this is normal. Here's an opportunity for a caregiver to have some more education, for them to have the support they're looking for without having even more people in the home. In the time of COVID, people don't want extra people coming and going, but they still need that support and that reinforcement that they're doing right. Telemedicine allows so much of that. It keeps things very personal and in the home without adding to that stress level of more people. I can see that it's not going to change when COVID hopefully goes away or slows down. It's just an enhancement that we've discovered by being forced into that. The nurse can give that assurance. They can help them virtually through pretty much anything that's going on. Like Samantha said, we can't do some of the hands-on stuff because we're not there. But the instruction part is one of the main tenets of nursing. It's education, whole patient care and education. So the platform allows for that on a daily 24/7 basis. We have someone available immediately through Tele-Care to answer questions and to be that assistance. I'm passionate about palliative care and hospice care. I love what telemedicine is doing, both for me as a family member of someone in that position, but for me as a nurse, being able to help others. And I know I could talk about it a very long time, but I am going to probably cut it short. And I appreciate you all participating in this. I have some references that I can put up, and then I know we can have more of our great questions. So here's some great resources that are available to everybody, and that'll be on the link when they talk more about where to find all this information. Thanks, Al. I appreciate it.
Well, thank you, and you and Samantha did a great job in explaining this. You know, I think the most important thing is this incredible change to telemedicine that's come about because of COVID. So I've got some questions, and then we'll get to some questions hopefully that our participants will ask. How do you bill for telemedicine visits? Is it the same as in person? So maybe Samantha and Mary can talk about that. So Samantha, you want to tell us how you bill for it versus a in-person visit?
With the billing side of things, a lot of the insurance companies have adjusted. We don't know if that's going to be temporary or forever, but they've adjusted their allowances, I guess you would probably say, maybe Mary, for those visits. My understanding, you can correct me too if I'm wrong, Mary, but I do believe for the patients who we've had to have an in-person visit afterwards, you're not double billed for that visit. You're only billed for one of those office visits that day. So, but insurance for the time being has actually adjusted it. So it's billed like an office visit, and it's typically billed just like when you're in office for how much time spent.
And are you finding that you can see far more patients with telemedicine versus in office, or is it similar?
I think it's pretty similar.
Okay.
I would say it's very similar, maybe a few extra because we don't have the drive time. For us, the drive time is on our side, not on the patient's side coming to a clinic. So we're able to see a little bit more. And like Samantha said, the billing, there have been so many changes, sometimes daily, on what's allowed, what's not allowed. Yes, we can bill. It's not very different from how palliative care billing has been going on.
So it must be a huge advantage, Mary, for your patients because being able to stay in their home and not go to a specific visit must be a huge advantage, really, on both your sides.
On the hospice and palliative side, palliative care, they don't usually come to see our providers. They might be going to see their own specialists. So we can help alleviate some of that by by Zooming in or adding others to our virtual meetings. On the hospice side, we always go to our patient wherever they may be living. So this is allowing for those extra visits, some of that hands-on stuff, hands-on, ear on, when we're doing it all virtually.
Thank you. And this is a really interesting question and comment, and I'd be interested in hearing from both of you on this because it certainly is a challenge for telemedicine. This gentleman says, or person says, I have a severe hearing loss and need captions on webinars, but my doctors don't provide. There's your office. I know it's available on Zoom with automatic speech recognition. So if somebody is severely hard of hearing, how does telemedicine work for them?
Do you want to start, Mary, or?
Fine. We have not been using the closed caption. If it's something that was pre-recorded, it's easier to use closed caption as in a webinar. But for live, it's very difficult. And I think it can be more confusing because what shows up is not necessarily clear or what was meant to be said. So we don't use that. We have some patients that are hard of hearing, and there are different attachments for some of their equipment that helps with that. But we don't have any closed captioning right now.
Samantha?
Yeah, and it's also the same for our office. We played with some of the live transcription options available, but it wasn't as accurate. So what I would say to a patient, we've had two that we really did. We lengthened the time of the appointment to allow the provider to have more opportunities to have some back and forths of, no, wait, go back. I misunderstood that section. The live, almost every platform has some type of like live chat available. Mm-hmm. So being able to put in, there are just certain sounds if anybody hasn't had exposure to a severe hearing loss, but an S sound is a whispered sound, is an impossible to hear in real life, let alone over video cameras. So we've had instances where we had some communication breakdowns and it was easy to just kind of stop and go back. So setting up some of those kind of communication strategies at the beginning of one of those calls. Somebody who has a severe to profound hearing loss can still catch a lot of things, especially if it's visual. So making sure that the provider is not backlit where they can't read their lips. And then being able to slow things down and go backwards and, a hand signal of, oh, wait, I'm losing things here. And chatting back and forth, but the live transcription options I don't think have caught up to what's maybe available through TV, which is typically pre-recorded, which is why those captions are so accurate, but nothing yet.
Well, I hope that's something that does get improved upon, because there are a lot of older people who the telemedicine can be a huge advantage for, but can be difficult. My mom is a good example. She doesn't hear real well. She does okay in person, but phone is more of a challenge. So hopefully
and I know, sorry to interrupt, Al, but I know with some of our patients, we've been called in as the audiologist before one of the other providers' meetings to help to repair their hearing aids to their phone so that they can get that bilateral hearing. So that's helped in some cases, but depending on the severity of loss, there's only so much you can kind of do. But yeah, I hope that things do start to catch up.
Same here. And somebody joined late. You did address this, Samantha, but perhaps you could do it again and maybe describe it a little more. Is how do you handle hearing tests via telehealth?
There are some limited options that are available. There is equipment that exists that's not really practical for our current area. It is typically designed for like Eastern Mountain type areas, South Dakota, where you have to travel hours and hours to see a provider. So you set up like sites to have that equipment available, and then you can test. I can test from Boulder, Colorado to Africa. That equipment is really expensive and just not practical for having lots of people access it. So right now, the only remote hearing tests we've been able to access have been through existing patients' devices. So we've been able to do the grade school, raise your hand when you hear the beep type of testing. We've been able to do that remotely, which has been an improvement from where we were 6 months ago. But that's where we're at right now.
Excellent. And how about email versus telemedicine? Just being able to chat with patients who might have a sinus infection or something that's relatively common and minor, but is obviously impacting their lives.
Typically, we would still recommend setting up a telemedicine visit. And even if that's just a live chat type of visit, if maybe somebody doesn't have webcam set up or something like that, but there is going to be a back and forth regarding onset of symptoms and duration and things like that. So I know that there's still going to be a back and forth that's just not, you don't want as a patient or as a provider to kind of pick up and put down that case history. So having it done and having a set time for the provider and for the patients, even if it's just in a series of email exchanges or a phone call sit down, is still recommended.
And email works nice for providing directions. You've had your little video meeting and you want to be sure that they understood how to take the medication or what the new directions are. You can send a recap email that has all that information in one place, a little bit more lined out than the conversation. They can print it from home or refer back to it, share it with their family member. So email for that is good. For just the, like Samantha said, the back and forth conversation, it's much more cumbersome.
Excellent. And the same person that asked that question is about the hearing tests is, are they accurate? Are the results accurate, Samantha?
As accurate as can be had depending on your environment. So when we do our testing, we pay to have it calibrated, we pay to make sure that everything is soundproofed and things like that. So if your hearing aid has an open dome and your dog is barking in the background or the dishwasher is running, we take it with a large grain of salt, but it has been useful in identifying if there is in fact a change, or if it's stable, then we can cross that off our list of things to worry about for a patient. If there's a change, we take it with a grain of salt until we can resume normal traffic of in-person appointments.
And in palliative care, you know, having listened to the presentation yesterday from Jessica O'Leary, she talked about the types of maladies that you're dealing with, Mary, on a daily basis. So maybe you could talk about a lot of telemedicine is minor stuff, but in your case, you're dealing with Parkinson's disease, heart issues, cancer issues, and maybe you could talk a little bit about how that challenges telemedicine versus simple kinds of issues that you might address.
That is actually part of the fun of telemedicine, is that we can customize it for every single patient. Parkinson's disease, not every single patient's going to have the same care plan. Some patients might want to have a daily reminder through their care plan of when to take their medicine or what they should remember to do. You can customize it per patient. And I think that, to me, is one of the best things about this program. It is not a cookie cutter program. Palliative care and hospice care is so customized per patient by their team members. Our PACE program uses telecommunications, and that's a whole different type of population, and they're able to customize it for what they're looking for. So I think that is part of the beauty of telemedicine. It's actually easier to customize than just those visits into the office where you have X amount of time and you're pretty limited.
Yeah, I think if you were to ask most people, they would tell you that the biggest issue is convenience for them in their lives. People are afraid to go to the doctors, and the process of going to a doctor is not easy all the time. And having this added, Samantha, so your work with your thesis and your and in your education was really prophetic in what's ending up being and will continue to be a growing side of medical treatments.
Agreed.
I don't think we have any further questions. I just want to say to both of you that was fascinating and informative, and it was very helpful for people to understand maybe that haven't dipped their toe in the water of talking to their doctor either through email or through a telemedicine visit. So thank you so much for taking the time today and spending time with our participants. And I wish you a wonderful afternoon.